Assalamualaikum and good morning. Today we from Top Editor Team would like to present our proposal on the magazine outcome for the July edition. For this 6th issue, aligning with health issue arising in Malaysia, we would like to discuss further regarding on how medical or healthcare do their records. Before that, let me briefly show our team members who are involved for this edition. Each of us were assigned to propose on different topics to make this issue succeed and attracting to readers. Without further ado, I will pass to the first presenter.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is ASSYIFA BINTI AZHAR. So this is the content for the whole magazine. The definition of the medical, health and patient record are presented at the beginning of the magazine, followed by a comparison of electronic medical record and electronic health record, and a list of the types of record required in hospital. I had been given the task of writing this piece, and I was also in charge of proofreading the magazine's entire grammar. Okay, as I mentioned before, this is what I have done for the magazine, where I was assigned to create the introduction of the magazine. So the first thing is, I was explain the definition of medical, health and patient record and identify whether these three items have the same meaning or not. From the definition, I can say that all the items have the different terminologies but have the same meaning. Next, I was explain the differences between electronic medical record, EMR, and also electronic health record, EHR. For EMR, it refers to everything that you find in a paper's type, such as medical history, diagnosis, medication, immunization dates, and allergies. While EMRs work well within the practice, they are limited because they don't easily travel outside in practice. In fact, the patient's medical record might even have to be printed out and mailed for another provider to see it. While for the EHR or electronic health record is a digital record of health information. It contains all the information you find in the paper chart. They are built to share information with other healthcare providers such as laboratories and specialists. So they contain information from all the clinicians involved in the patient care. EHR are designed to reach out beyond the health organization that originally collect and compile the information. And lastly, I briefly explain the types of requirement in hospital, which is patient case note, pharmacy and drugs record, nursing and wards record, X-ray record, pathological specimen and preparation, and lastly, patient indexes and register. So, for the patient's experience to be beneficial, the hospital staff must be aware of all the various record types that are required. That's all from me. Next, I will pass to the next presenter.
Next, I am FARAH and HARUN will continue the presentation. I have been assigned the job to create the detail about EMR that relate with the comparison between the EMR, EHR and the paper medical records, and to identify what is the importance of medical record to the insurance companies. I also have been given the task to edit the format in terms of the arrangement of the sentences and pictures of the magazine. The first subtopic that have been created by me is the comparison between the EHR and the conventional medical records. In this subtopic, I mentioned 5 comparisons between these two records. First is access to EHR can be limited to authorized user. Second, EHR are difficult to tampering. Third, user can build an audit trail with an EHR. Fourth, user can backup data on EHR. And lastly, fifth, EHR are not easy to misinterpret. Second subtopic is the comparison between EMR and the paper medical records. In this subtopic, I also mentioned 5 comparisons between these two records in terms of cost, storage, security, access, and updation. The last subtopic that have been created by me is the importance of medical record to insurance company. Under this subtopic, I highlight three important of medical record to insurance companies. First, insurance company need to verify the information on application. Second, the insurance company need to make underwriting policy. Third, insurance company need a medical record to compute the value claim on applicants. Next, I will pass to the next presenter to continue the presentation.
Hi, my name is SALSABIELA binti HASSAN, the third author of this Biz Record magazine. I was assigned to print out the full magazine after all the contents are completely done and approved by the other author. Okay, the next contents in this magazine are impact electronic medical record on hospital and the challenges in implementing electronic medical record for healthcare industry. In writing the impact of electronic medical records, I focus on the positive effect on the hospital quality, revenues, and hospital communications. These three things are the most significant impact that we obviously can see, which can affect the hospital. Next, I also write about the challenges in implementing electronic medical records. As we know, electronic medical record is one of the technology in today's world. There are many challenges or barriers in the electronic medical record implementation process. But I just pinpointed the top 4 challenges, which are the cost of implementations, time constraint, leadership style, and technology barrier. In the past interview session, the hospital staff said that the hospital needs to bear the high cost of implementation in maintaining and effective electronic medical records. They also say that the training must be conducted for every staff to ensure all of them know how to use the system in electronic medical records. The training itself is already time consuming and it becomes more challenging when there is a poor leadership from top level management. Electronic medical records is a new thing to them, and of course, they might face some problem in dealing with electronic medical records. This shows the barrier of new technology. Okay, that's all from me. Thank you, and I will pass to next presenter.
Thank you. Back to me, I am FARHIRAH JAMALUDIN will continue. The topic I choose to discuss are the importance of EMR and the brief information about RCM. To make this edition work, I am assigned with interviewing the healthcare person along with FARHIRAH. In this section, I would like to discuss about the importance of EMR in terms of hospital profit. EMR documentation is the core of the medical billing process. Based on our research, we found that the increased demand on the organization and fewer staff members to address the medical and coding concerns, it is become even more important to reduce and eliminate the errors. These 6 steps are the result to our research, and I took overall 3 pages on discussing this matter. As conclusion, the aim of this topic is to get the organization to know that by practicing EMR, it can help in redesign workflow to optimize staff time and resources for the tasks that really need time and attention. Thus, this will assist the organization to improve the patient flow so better outcomes can be achieved. Next, we also find that it is necessary to discuss about revenue cycle management, or known as RCM, as RCM is oftenly associated closely with EMR to generate the profit. RCM is the process of uniting the business and clinical aspects of healthcare by combining administrative data with the treatment patient receive and their healthcare data. From our interview, we found that these 3 major factors are affecting the revenue cycle. Thus, we see the importance of this to link with our overall magazine studies. That's all for me. I will pass to the next presenter to continue.
Hi, I'm FARHIRAH ZELAN, the author for the next subtopic, which is how medical record increase the business income and the productivity by using electronic medical record. My job task is to editing pieces from other writers and conducting research to include factual information and stories. The subtopic for how medical record increase the business income and productivity by using electronic medical record is about to explore electronic medical record implementation for healthcare used to improve productivity and increase business income. There are three major questions, which is: will a hospital increase business income if it uses an EMR system? Second is, will a hospital productivity increase if it uses an EMR system? And the last one is, will a hospital become more effective if it uses an EMR system? In the healthcare industry, profitability is attained through increased revenue generating activities and the elimination of unnecessary expenses. EMR has the potential to bring down healthcare expenditure and boost earning. Under this topic, it has been shown that the electronic medical record increase workflow efficiency by reducing the time needed to pull chart and enhance access to comprehensive patient data. With the help of technology and changes in the healthcare, EMR can be a vital tool to improve productivity.
Next, the software that we use to create this magazine is Canva. Why we use this software? It is because during COVID-19, we need to work from home. So, Canva is a suitable software to use for group work, since we just share the link to our teammate to continue the edit and view other teammates' work. Second, Canva is very simple to use and also user-friendly. And lastly, Canva has provided many templates of the correct sizing for other online platforms, such as Facebook, Instagram, and more.
That's all from us. Thank you so much for your interest and attention. Your consideration and response on this matter is highly appreciated. Thank you again.